After 15 years of doing drugs, Angela Stephan has moved into a women's shelter and, for 2 months, stayed clean. The Regina woman became alarmed after losing 24 friends and acquaintances to drug overdoses.
It's scary when you wake up. You don't know who's going to be gone from overdose.
This year, emergency services have responded to more than 12 times as many overdose calls.
That doesn't include those that go unreported to like police or emergency services. So we know, sadly, that number is probably double that.
I would say that it's nothing short of a medical crisis.
Dr. Alex Wong has lost 15 patients to overdose deaths since the pandemic started. He says there's limited access to doctor's appointments and safe prescriptions, turning people to street drugs, including fentanyl. The potent drug is now fairly easy to find in Saskatchewan. In some cases, there have also been bad batches of drugs. Plus, Dr. Wong points to isolation and other social issues exacerbated by the pandemic.
The system is already so strained managing COVID that we haven't necessarily put the same amount of time and attention as we otherwise would in a normal year towards addressing some of what we're seeing in terms of overdoses.
The province has pledged more money for treatment beds. Katrina Long's 54-year-old mother, Josephine Isaac, died from a fentanyl overdose in June after getting an influx of cash from the federal CERB program.
She ended up getting an extra $6,000 that basically went to drugs, and within the 3 months of receiving it, she had passed.
I do a lot of praying because it numbs you out.
So much loss could be what saves Angela Stephan's life.
I didn't want to die. The next time I used, I could be dead. And I'm not ready to die yet.
Bonnie Allen, CBC News, Regina.